I had to look up this guy's name, Chris Cillizza, I think his name is. I'd never heard of him from the Clown News Network, but he had a really horrible article. This is almost 2 months ago now. Really bad article that Keith W. Carlson over at the Federalist steamrolled, and I added some info. Keith W. Here's what I wrote. I'll leave all the links underneath the video, of course. Keith W. Carlson takes CNN's Chris Cillizza behind the woodshed for some of his factually challenged commentary on Florida and California's response to COVID-19. And here's what Keith said. Compare CNN's COVID-19 coverage in California to Florida, and you'll see the problem. Here on April 10th is editor-at-large and political reporter Chris Cillizza on Florida Governor Ron DeSantis. Quote, unfortunately for Republican Florida Governor Ron DeSantis, the fight against coronavirus has exposed the fact that he may simply not be up to this moment in history. End quote. The basis for the fact the governor is not up to his job, DeSantis' statement. Quote, I don't think nationwide there's been a single fatality under 25. For whatever reason, it just doesn't seem to threaten, kids. And I added this note. That's the end of the quote. And check the link I've got underneath the video. I've got all this. Note, remember my data showing roughly 48% of all deaths in the Big Road Apple, New York City, were 75 and older, as well as hospitalization rates being many times greater for those 65 and older. Cillizza pounced. He cited the CDC data showing 5 people, count them, 5 people younger than 25 years old have died from COVID-19. 3 were under 15. With 330 million people in the U.S., that means a full 0.000002% of the country had died of COVID-19 while under 25. Cillizza neglects the larger point, which DeSantis correctly made. The virus has a much greater effect on older people and drug addicts in Dayton, Ohio. The CDC's provisional death count, it's not like the virus is, we're seeking out people with drug problems, people with immunodeficiencies. No, if you get it, heroin addicts in Democrat districts like Dayton, Ohio and Gary, Indiana, yeah, they're not going to do well. The CDC's provisional death count on April 23rd showed 23,358 had died and only 3 younger than 15. 99.99% were not the kids DeSantis spoke of. Despite DeSantis prefacing his statement with, I think, 99.99% wasn't good enough for Cillizza and CNN. DeSantis was off by 1/100% consistent with CDC findings and understood by 99.99% of his audience, just not by CNN's editor-at-large. The governor of any state, Cillizza wrote, shouldn't be making statements like the data has been 100% consistent if he doesn't know that with 100% accuracy, end quote. Consider this praise article a day earlier lauding California and its governor, Gavin Newsom. We'll get to some of that in a second. Newsom was first to order statewide restrictions. He ordered millions of masks. He over-acquired ventilators. California leaders took it seriously and tens of thousands of lives were saved. This is Carlson's talking still. The article does not explore why, just a few days before, the IHME projected peak resource day, Newsom would send ventilators out of the state. It doesn't remind us that on March 18th, the governor wrote Trump that 25.5 million Californians could be infected, with some 5 million being hospitalized. The governor was trying to increase California's 20,000 plus hospital beds to 100,000. But by March 20, the governor's head of Health and Human Services confirmed the governor's numbers were off based on bad modeling. And in my article, I cover a lot of that. There's a lot of bad modeling, even by the so-called experts. On April 23rd, the IHME predicted a total need of only 2,503 beds, with only 33,261 cases statewide. That's April 23rd. 100,000 beds to an actual need of 2,503 is 2.5% accuracy. Bad modeling indeed. Total cases in California to date, remember this is a while back, 33,261, only 25,466, 25,466,739 more to hit Newsom's number. After California's own peak, we see Newsom was 0.1% correct, 99.9% incorrect. No word from CNN and Cillizza on these numbers. Here are a few more considerations for the Florida-California comparison. Again, this is still Carlson talking. California's population is 39.5 million. Florida's is 21.5 million. The average in each state, age in each state is California 36, Florida 42. Floridians, an average of 6 years older. As of April 23rd, California had 33,261 cases and 1,268 COVID-19 deaths. Florida had 27,869 cases and 867 deaths, meaning 0.08% and 0.1% of those states' populations were infected. California's death per infected rate at that time, 3.8%. Florida's 3.1%, with an equally small percentage of each state's population having died, less than 0.005%. For you progressives out there, that's 5 thousandths, 0.005 thousandths for any of you idiot progressives that may be listening. California's 39.5 million people are spread out over 163,696 square miles. Florida's 21.5 million are over 65,755 square miles. Thus, California has 241.3 people per mile. Florida has 327. California's restrictions started on March 19th. Florida's 2 weeks later on April 3rd. California's peak resource date was April 13th. Florida's was earlier on April 12th. According to IHME forecast, both states had substantially more hospital and ICU beds than needed. Neither governor had a crystal ball to perfectly predict where this crisis was going, but one got fawning coverage, the other was attacked. This, even though Florida has an older population, is more densely populated, and DeSantis kept its economy going longer. And that's the end of Carlson, what he said. And I added this, see here, and I've got the link. Florida is indeed more densely populated overall, although San Francisco is one of the most densely populated areas in the U.S., and Florida has a much higher percentage, as well as different demographics. If African American folks turn out to be more susceptible to the ravages of COVID-19, that would explain a lot of data. Florida has a much higher percentage of their population that is more than 65 years of age as well. Other than being older, you need to go a little bit further, and I did, and I got the data for that. Florida has a lot higher percentage than California. That is 65 and older, and that's much more than the U.S. average. As of June 6, 2020, Florida had 22,688 deaths, which is a death rate of 12.515 per 100,000. California had 4,604 deaths, which is a death rate of 11.652 per 100,000. On May 23rd, 2020, California passed Florida in infections per 100,000 for what that info was worth, because there are likely a lot of cases not detected at this time. And as they do more antibody testing, I think we're going to find out a lot of people had it. As Carlson noted, California has been locked down for some time, and Florida didn't engage in the lockdown madness, at least not to California's extent. We should also note that the 7 states that didn't have a shelter-in-place order, Iowa, North Dakota, South Dakota, Arkansas, Wyoming, Utah, and Nebraska, collectively have a deaths per 100,000 figure much less than California. Uh-oh. Sleaze didn't know that, of course. Carlson also mentioned how New York, and I can add several northeastern states, have been ravaged by COVID-19. But the little man, Chris Cillizza, isn't giving Cuomo and de Blasio the Ron DeSantis treatment. As of June 7th, 2020, the Florida Department of Health reports, and it's on page 3, that 85% of all COVID-19 deaths in the state are folks 65 years of age or older. Again, as of June 7, 2020, the Florida Department of Health reports that 85% of all COVID-19 deaths in the state are folks 65 years of age or older. 64% are 75 years of age or older. Not a shocking development in a disease that preys on the elderly and those who have immunodeficiencies. In California, as of June 6, 2020, 78.3% of all deaths attributed to COVID-19 are folks 65 years of age and older. 58.5% are 75 or older. In conclusion, due to demographic differences, Florida is no worse off than California, no matter how many hissy fits Miss Chris Cillizza has over it. In fact, one could argue that young, healthy folks in the Golden State are worse off because many of them have lost their jobs and may never get them back, all while being confined in their homes most of the time, going bonkers. How many Californians will sink into alcohol-fueled depressions because of this constant lockdown? How many Californians will commit suicide because of this? Is it worth it? I think not. California could do like most sane folks do. They can be open for business and still protect those who are elderly and those with immunodeficiencies. I mentioned this before. What if you have a 66-year-old man still working because he thinks he will outlive his savings and his vaunted Social Security benefits? What if the risk of him working is worth it to him? You're just going to keep him locked up in his house for a year? So Chris Cillizza, you don't know much, little man. You're a horrible writer, a partisan hack, and an idiot. And I've been watching this COVID for a long time, the long game. So Chris Cillizza, I think you need to go back to writing for some like small newspaper. And yeah, I don't think you're up to it, Cillizza. But you do fit well in real good with the rest of the fake news idiots on CNN. So Chris Cillizza, don't thank me now for the correction. That's free.